There's some people who, because of their age or their medical compromises, just can't go through a lot of surgery.
Right.
And they just don't have enough bone for us to work with. We can then use, as we said earlier, extra oral sources like the cheekbones, zygomatic implants, pterygoid plates, which are behind the maxilla, vomer process, floor of the nose, behind the front teeth. These areas can be used to anchor implants that can then support a prosthesis in the same way. But as you said, that takes another extended amount of training. Why? Because you're dealing now with the orbit of the eye. You're dealing now with the sinus. You're dealing with a very long implant that's sometimes going to be 45, 55 millimeters long, not 10.
Right.
And you really have, arteries and blood vessels and nerves that travel in the pterygoid plexus. You need to know how to do these procedures. You need to have significant training in that. Not that it can't be done, it can, but they need to have the training. So those are available to you. If you're a patient that has no bone, if you went to a dentist, I've had patients come in and say, I went to somebody and they told me I'm not a candidate. And that's true. You may not be a candidate for conventional standard implants, but almost everyone we've seen, I'd say 99.9%, the candidates for different types of extraoral anchorage implants, whether there's zygoma, pterygoid plates, vomer, or even in the mandible, there are other ways for us to anchor implants into the basal bone.